I am Dr. Kirby Thompson, licensed naturopathic doctor and acupuncturist, owner and operator of Wildflower Wellness. And today we're here for Dr. Kirby's Pick, October 2021. Now, the last couple of months, I'd like to thank you for your understanding. We've been through illness and my mother's death. And I would like to thank you for your understanding in both our practice and also our social media, as well as videos. Dr. Kirby's Pick is one of my favorite things to do. I just love being on the film, and I thank you so much for watching. I appreciate you, and as always, just let us know what we can do for you. Now, Dr. Kirby's Pick, October 2021. Is it 2021? Can you believe it is October? Well, this month in our social media, our topic is hydrotherapy. Now, hydrotherapy is one of the roots, the fundamentals, the foundation of what our naturopathic medicine, how our naturopathic medicine got started. One of the greatest therapies, Father Knopf, Benedict Lust, all of these greats really used hydrotherapy. It's not, unless you go to a naturopathic doctor, you really don't see a lot of hydrotherapy. I suggest it for people depending on what they come in for all the time. Now, what we're going to talk about today is make sure that you look at our social media, both Facebook and Instagram, and we're going to give some instruction as well as, indications. Why would you want to use this? Contraindications. It's going to be great. Like and share with your friends, your family, and heck, why not share it with strangers? Now, what I have here is a bowl of ice water. And isn't it amazing how water and a towel can make actual changes in your symptoms? One of my favorite, actually I have quite a few favorite hydrotherapies, but one of my favorites is hot and cold alternating towels and or baths. So I sprained my ankle and man, it was hurting. And what I did was, and I had an acute issue. So what you want to do is you want to put your towel, and this is not big enough, this is just for example. You want to get it pretty, you kind of want to soak it in that cold water, right? And say you sprained your wrist, right? You'll want to put that cold water over your wrist, and you'll want to change that you want to re-dip it every 30 seconds to 1 minute. Now, why would you want to do that? The cold water can have the physiological effect of slowing that edema and inflammatory chemicals getting to that area, which can help later on with trauma. Now, when to use hot? My favorite way to use hot is, of course, muscle relaxation, things of that nature, spasm. Heat is great. But we also have alternating hot and cold. The best example is a friend of mine. A friend of mine actually had a knee strain. She went to the doctor. They referred her to a big clinic. They couldn't find anything on x-ray, and she called me and she says, "What do I do?" I said, "Do this. Take some alternating hot and cold towels. It's got to be in ice cold water, and it's got to be in hot as you can stand it water. Do not burn yourself. Don't overdo." I did that in the bath the other night. It was not a good thing. And what you do is you would put that on the area, hot, cold, 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 hot, ending in cold. Now, why would you want to do that? You would want to do that because you'll want to get hot, right? Hot opens up the lymphatics and the vessels and allows fresh blood and oxygen to come in and perfuse that area, kind of get in there. Then the cold constricts it and it will go back in, and that causes a flushing of the tissue. So my friend did this. She did it every day. I think she did it twice a day. And then after the application, I asked her to put castor oil on that knee with the addition of frankincense and myrrh essential oils. So the castor oil will be the carrier, and the castor oil works by itself. But she was in quite a bit of achy soreness, right? And again, this was a long-term thing. She said in about a week, she was able to start walking again. Hydrotherapy, when done effectively, does work. How many of you love a bath? I love a bath. Bath is hydrotherapy. Now, there's different kinds of baths. But my favorite bath, of course, is the hot as you can stand it, full immersion bath, which actually really, with Epsom salts, of course, and most likely some essential oils for myself. But what that causes is vasodilation, muscle relaxation, and that magnesium can be absorbed systemically. So remember, magnesium is a cofactor to over 500 different reactions in the body and is necessary in order for the muscles to work effectively. It also is very effective in relaxation, not only of the muscles, but the vessels. So there's muscle around the vessels, and that can relax. It has been shown in some studies that baths can increase your oxygen to perfuse your body up to 3%, which I think is pretty freaking cool. I didn't just found that out. I think that's awesome. It also relaxes the body. And Eli Jones in the early 1900s was a medical doctor that addressed cancer with herbals, homeopathics, and other types of natural substances. And he said the number one way to prevent it was to take an Epsom salt bath. So why not? I try to do right now, I think I'm doing 2 or 3 a week. But if I could do it every day, I probably would. We have to make the time for ourselves. Now on our social media, there's going to be some other things that are great. We're going to be talking about wet sheet packs and constitutional hydrotherapy. Constitutional hydrotherapy has been said as the best way to stimulate the body's internal healing mechanism. It can strengthen the organs, decrease toxin, and get the body blood flowing more effectively. I have personally used it and I love it. We do offer it at our clinic, and I look forward to that post coming out on Facebook and Instagram. So give us a call, visit us online, follow us on YouTube, Facebook, Instagram, and I think we may even have Twitter. And give us a call, visit us online at www.wildflowerwellnessllc.com. Thank you so much.